Oh my goodness. Hello, 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 family. Welcome back. Welcome. You are tuned in to Love and Life on WURD Progressive Black Talk Media. That's 96.1 FM and 900 AM. If you have just joined us, if you were not present for the first hour of the show, we've been talking with none other than Dr. Paul Gittens, who is the oracle when it comes to sexual health. He has given us all kinds of information and he's going to provide us with some more. So, how lucky are we? We talked about so many things in the first hour, so much for which I am grateful. So, thank you, thank you, thank you so much, Dr. Gittens, for number one, joining us, and number two, staying with us.
Thanks again for having me. I'll tell you, it's been a great conversation so far. I probably should have, I'm wearing a shirt. I don't know if you're, obviously it's on the radio, but I should have probably not wore the shirt and tie. It's getting hot in here. It's getting hot in here.
No,
Yeah,
no, no, it's a good
tie
thing.
off and unbutton my, unbutton my top button here. I don't know.
No, well, you look good. You look good. So it's a good look. And I mean, our family members will be able to see you as well because it'll be live streamed. So they'll be able to see you as well. They're looking right at you, looking right at you. So that's a good thing. That's a good thing. You wear it well. So what can we
Thank
say?
you. Thank you.
You're welcome. You're welcome. So I, family, asked Dr. Gittens just a few questions about sexual dysfunction. Because that is one of his specialties with regard to both male and females. And we had some questions in the first hour, one of which was about natural remedies. We asked Dr. Gittens if he had any recommendations or any suggestions of any kind, and he said, "No, I do not." But he will keep that in his back pocket, and he'll let us know if that changes. But I would like to know, was that specific with regard to men or women or just overall? Did you have any
Yeah. So, when it comes to natural things that we can do, one of the best ways that we can combat kind of erectile dysfunction or sexual dysfunction for men and women, depending on what we're talking about, is with a number of these newer restorative therapies. And so when I say restorative therapies, that means we're stimulating the body, right, to start to heal itself, right? If that means making better blood vessels, if it means making more collagen, to stimulate itself. So guys, if we're talking about men, if they're on some oral medications, maybe we can get them off their oral medications, right? And then when we talk about some of the other treatments for erectile dysfunction, some guys have to be on injections for erections. And so by stimulating and restoring the penis, we can maybe get them off of their injections and allow them to go back on pills, right? So that's one of the things, and that's something that we do. It's something called Core Wave. So I'm proud to say I'm the founder of Core Wave, and I teach urologists from all over the country on how to perform these procedures in the office. So physicians come to my office we have Core Wave physicians up Florida to California and Texas, all over. And we teach them how to use these shockwave therapies. It's called low intensity shockwave therapy that stimulates the penis. By doing that, we increase the blood flow, and as you know, better blood flow is going to add to a better erection.
Sure.
For women, one of the things that we do for restoration is we use something called the Mona Lisa laser. And the Mona Lisa laser is a laser. It was first built out in Italy. It was first when they did all the research, and I was fortunate enough to do some of the animal studies for them. And what the Mona Lisa laser is that we place a small laser probe in the vagina, okay, and the laser then activates the tissues of the vagina to make better blood vessels. It increases collagen. And so when you talk about that atrophy and that thinning of the vagina becomes more thick, and so you don't have the pain with intercourse. You get more lubrication, more moisture. The pH changes as well, and that can help with a better sexual experience. So those are some ways that we naturally restore the erections or for men. And then when it comes to women, how we can kind of turn back the clock on their vaginal health. So those are two examples that we do that are very successful here in the office.
Oh my goodness. Well, first let me say thank you and I commend you on your finding, on your research. Thank you. Thank you for all of your contributions. I'm sure I'm not the first, but to say that, but thank you. Thank you for that. We appreciate that. Something you mentioned before about a female's pH balance. How important is maintaining our pH balance to our physical health?
Yeah. So the vagina has a certain pH, okay, and that pH allows for bacteria, good bacteria, to live and thrive. And that bacteria, when it's needed, it's going to fight off the bad bacteria, which could lead to urinary tract infections. If it's like yeast, it can fight off some of the yeast that's in there, that's in the vagina, that can develop over time. And so
Sure.
the pH is really important. We don't recommend any, some women, they'll do kind of these vapor washes or douche or anything like that. That's actually going to throw off the pH even more. But your natural pH is really, it's stirred by the estrogen balance that you have. And so
Hmm.
as women get older, the estrogen is reduced, it's diminished. And so then the pH can change, and then women can be subject to a number of these things that we talked about before.
Oh my. I've had I had a conversation in the more recent past about maintaining a healthy pH balance. I had no idea just how important it is or was. Well, it is. And the conversation led us to talking about feminine products and the different products that are on the market and all of that.
Well, what I would say, that if you're a woman of reproductive age, your hormones are normal, the
Mm,
pH balance is most likely going to be normal as well. All right.
okay.
There are some things that can throw that off, like antibiotics. Antibiotics can definitely throw your pH off. And so, those are things that we just have to be aware of. And once we're aware of that, then we can treat those things.
Mm,
But I wouldn't. I don't recommend anything over the counter to be placed in the vagina to change the pH. It actually, it makes things a lot worse. So I
y-
wouldn't do any of that.
yeah, I had no idea they have all kinds of
They have
products. So
everything:
they have everything that they tell you is supposed to, and
soaps,
that's
creams, gels, anything you want. They
I mean, and
Yeah,
that was how the conversation came about because, just talking as we do, ladies, we have these conversations. Well, I don't know if you do with your girls, but with my good cookie girlfriends, we talk about everything. So
who doesn't want a healthy vagina? Of course,
who doesn't?
right? It's something that we all want, but you know, like I said, if you are not in menopause, sometimes birth control can change things a little bit, and medications, but most likely the pH is going to be fine.
Mm,
But
hmm,
if there are, the reason why a lot of women are concerned about that is if there's an abnormal smell or something like that.
mhm,
If that's the situation, then you want to make sure that there's no sexually transmitted diseases or anything of that sort. You want to make sure that you're not douching, you're watching your soap, you're watching not just the soap that you're using in the bathroom, but also the detergent that you're using, the
ah.
type of underwear that you're using, if it's cotton versus if it's nylon or what have you. Those things can also change the pH of the vagina.
That conversation is an interesting one to me. I mean, ladies, now we all like our lace and we like all of those other types of different types of underwear that are available, undergarments that are available to us. But I had no idea just how instrumental a part these different fabrics play. I had no idea about detergent, and I feel like, well, my question is this a new discovery? Because this is new information to me. And I feel like, I've been here for a minute.
Well, I mean, I think it's pretty. These things are probably known. I don't think it's any surprise to anyone. It just depends on like I do this every day, and so we have these discussions every day. So
Hmm.
for me, it's something that I always discuss. But for many women, especially if they've never had a problem, and then they see or smell something that they haven't seen or smelled before, then then it's a concern to them.
Mm. Mm. That's into I have a few more questions, but that will probably be offline because I don't know. You were talking about us getting kicked off the air earlier. I don't know. They might say, "Wait a minute
I
now."
told you, you don't want to talk to me for too long.
No, we need to know. This is where we talk about these things, right, family? If you have just tuned in, you are listening to Love and Life on WURD, Progressive Black Talk Media. That's 96.1 FM and 900 AM. I am Carol Riddick, and I'm having a conversation with none other than Dr. Paul Gittens. Now
And
we've gone over,
I'm sorry.
yes,
I just
no,
wanted to say that just because, just to not leave the topic off, I don't want to take it off the table yet. I
okay.
just want to say that, it's wonderful that you're really talking about this seriously. And the reason why is because, you know, um, in our culture, sex is all over the place. It's everywhere. It's on
Mhm.
billboards, it's on TV, it's everywhere, but nobody really talks about it. Nobody really has serious conversations about problems that happen with our sexual life. Nobody talks about it.
Mhm.
And so it's such an important conversation to have. I have patients that come to see me, and it really affects their relationship. I have guys that, will sleep downstairs and pretend to watch the ball game all night so they don't have to go upstairs and face some of the embarrassment that they may have, that they may feel because of erection problems. I have women that, they really avoid any kind of contact with their partner because they're having pain. Um,
Mm.
they're having issues or even just lower libido. So it's really it's a conversation that's needed. Um,
Mm.
I also think that, when it comes to, sexual problems, that people are just so, they're just so embarrassed. They really are. And it
Mhm.
affects their self-esteem. If you look at days off from work, I mean, it affects people on so many different levels. And it can't be understated. It really,
No.
I have women and men that feel like their body is just betraying them, right? That they don't feel like a man or a woman. They don't feel like they're doing their, I don't want to say their duties at home, or they just don't feel like themselves. And so once again, I applaud you for putting this on the air and really having a strong conversation about this.
I thank you for obliging and accommodating. I really, really do, because I agree with you. I feel that it is a necessary conversation. And like I said, I have these conversations with my girlfriends. We have questions, and I'm talking to you about some things of which I was in the more recent past made aware. Things that I was saying, wait a minute now, how did I get to be this age? I believe I take very good care of my temple. So how is it that I'm just finding out about some of these things? So I want to share, as I did explain. I'm an advocate for helping the next person, and I want to maintain my own health as well. So thank you so much for accommodating, obliging, and just being, patient through the process. Thank you so much. But
Yeah.
I think I will ask that hard question because, we do say at this show that we ask some of those hard questions. We ask the hard questions that, we might not otherwise want to ask in a public setting. But we're talking about, I was asking a question about a woman's pH balance. And I just talked about the different products that I've seen that are available to us. I mean, and as you said, they have everything, and gels and soaps and creams and whatever oh my. What should a healthy vagina smell like?
Oh, well, I think it's different for everyone, right?
Mm-hmm.
I mean, I think that, I think it's even made more evident after COVID, in a
Mm.
way, where we were all under a mask and we couldn't smell anything. And
Mm.
then now we remove the mask and you're smelling people. You're like, all right, that's what people smell like, And so everyone smells a little different
Mhm.
when it comes to just being, as well as it comes to their vaginal health. What we worry about is a drastic change, really, when we talk about smell, right? We worry about if there's any discharge. We worry about those things, because then we're thinking more of a pathology or STI or something like that. But everybody has their own smell. No one, everyone's really different. It's just it's really the change that we focus on.
Understandable. That's interesting. Thank you. Thank you for that. I was having this conversation, I should say, again with my friends. When you're you're a mature woman, we start talking about the conversations that we don't have. And that was one of the questions that came up, like, well, that's interesting. We never talked about that. Growing up, we never talked about that as young women. It's not something, having to talk about sex in our bodies has not been comfortable. It was never made comfortable for us. So I want to I want to move on to some other things. Something is stuck in my throat, and it is I rebuke it. So I'm making it known to the public that I am rebuking it. But I was talking to you about support groups for your different specialties. Do you have support groups at your office, or are there some you can recommend for the
Yeah.
different specialties?
So what I work with a number of therapists that they're not in the office, but I do refer a number of my patients, depending on why they're coming in. If they're a breast cancer survivor, then we would refer to some of the great groups in the Philadelphia area or outside Philadelphia. Um, if they have prostate cancer, there's some good groups support groups that we can help find for them. If we feel like their problem is more emotionally based, then we'd also refer to a good sex therapist. So I have a number of sex therapists from here to New York City to across the country, right? Where we would refer to that are individuals that really focus on whatever the particular needs that individual has. So it really depends. In our practice, I mean, for our practice, we do support and treat, I should say, we treat men after prostate cancer, after any kind of pelvic surgery. We'll help to treat them and help them get over any kind of sexual problems that they have. As I mentioned before, we also have a special program, which is a non-hormonal program for women that have undergone breast cancer treatment and therapy. So we'll also help them here in the office for that. But there's usually nothing we can't, I'm an eternal optimist, there's always something we can find for everyone, I was fortunate enough where my mother, she brainwashed me when I was younger. She said, you can do anything you want to do, right? You can do anything you want to do. So I still believe that somewhere. It's still that voice in my head. So it's always something that we can do. And if there's something that I can't do personally, then I'll try to find the best fit for that person. I think, and I think that's why we get a lot of things accomplished here.
Well, it sounds like your mother was right. From everything that I'm hearing you say, it sounds like everything you have set your mind to, you have either accomplished or are in the process of doing so. So kudos to mom. Kudos to your dad as well, but kudos to mom. I'm not sure if I asked you this question in the previous hour, but what is the main cause of male infertility?
So, it's a great topic of conversation, just because I'm glad you're even addressing it. Because most couples and just most people in general think that fertility problems are mostly due to women, right? And, women, they undergo all the evaluation for the most part. And then secondarily, they come to the male. But when you look at the numbers, infertility, when you look at, both couples, male and female, the male contributes about 40% of problems with fertility. So it's really important that the male patient is looked at, right? Because there could be a number of reasons why they have problems with fertility. Okay, and they range. So they could be. We kind of talked earlier about hormones. So hormones is a reason. So that's one of the reasons of fertility issues. So imbalance in hormones. One of the other things we touched upon was genetics. So there are some genetic conditions that can lead to lower testosterone. Lower fertility levels.
Like what, for example? I'm sorry to have interjected.
Which was for
The
genetic.
genetic, yes, I'm
Yeah.
sorry.
So um, there's one in particular called Klinefelter's disease, which is a problem with the testicles. There's, not to be too specific, but there is so men have an X and a Y gene, and on the Y gene that's where we make sperm. Okay, there's a special segment on that Y gene, on that Y chromosome, I should say, not gene, on the Y chromosome. So there's genes on that Y chromosome, and genes, they help to translate things. So they help to they read things, right?
Okay.
And so for some men, they're missing that whole gene, and they're missing that gene that is responsible for making sperm. And if they're missing it, then they can't have sperm. So that's another genetic abnormality that we look for. There's some people that have something called cystic fibrosis, and they could have just a portion of like a portion of their cystic fibrosis gene that can cause some problems with fertility.
I'm I am terribly sorry because I really want you to continue that, but I really want to go back to what you just said when you were talking about not being able to produce sperm. In those cases, what is there anything or what can be done to what can it be rectified? Number
Yeah,
one.
yeah. So there's degrees. So when we talk about male infertility, outside of the causes, so we see a lot of different levels of male infertility. There's some guys that just have problems with their count, right? So they can have a low count. Another way we characterize sperm is we look at their motility and like the direction that they're moving. So there's some guys where the sperm doesn't move, or they have decrease in motility. That means that not a lot of them are moving. And then you're looking at the progression. So you're looking at like how fast and the way they're swimming, right? If they're just swimming in place, that's not good. You don't want them to kind of swim like a tadpole, right? And then we also look at like their shapes. So you want the head to be a certain size. You want the neck to be a certain size. You want to have one tail. And so we can see a variety of issues with any of those factors that I mentioned. And depending on those factors is going to depend on what we're going to do. So there's some men that have what's called a varicocele, which are like varicose veins. Some people have varicose veins in their legs. Some guys have varicose veins in their scrotum, which can lead to problems with fertility. And so if that's the case, we do a simple surgery and we can correct their fertility. So the guys that have problems with their hormones, then we can correct their hormones, right? We can't give them testosterone though. So it's not testosterone because testosterone actually causes male infertility. I want to make that clear. So if a guy has some problems with fertility, if you take testosterone, then it's going to make your infertility worse. So no testosterone. So, but there are ways we can naturally increase their testosterone with certain meds that can help with their sperm counts. And so in the situation that you mentioned before, so what if a guy does a semen analysis? So we would do a semen analysis where we check all those parameters that I just mentioned. And if we did a semen analysis and there was no sperm, what do we do, right? And how do we make sperm? So if it's a bad hormonal abnormality, then we replace the hormones. But in some situations, we have to do a special procedure where I actually go into the testicle and then I will extract sperm. And then we would give it to an IVF team. And then the couple would go through IVF together.
Oh wow.
So for instance, I just did a procedure on a patient that had cancer when he was younger. And he did a semen analysis and there was no sperm on the semen analysis. But what I did something called a microtesty, which is a fancy word of saying I went into the testicle and I found sperm, which was then used for IVF. So those are some of the things that we can do.
IVF. How invasive is that process?
So in vitro fertilization is IVF, and it's it's the physicians that do IVF are OBGYNs that did special training in fertility. Just like for me, I'm a urologist
Mm-hmm.
that did special training in male infertility. All right. Doesn't mean that urologists can't help you, but in terms of specialized care, you want to go to someone that is fellowship trained and this is what they do, right? So for on the woman's end, the OBGYNs, as I mentioned, they go through special training, they go through IVF, they get trained in terms of how to deliver IVF. And so the process is you undergo an evaluation, they'll do hormonal evaluation, they'll also do some anatomical evaluations as well with ultrasounds, etc. And then they place you on hormones for a few weeks, usually about 10 days or so. And then at that point, you'll make more eggs. And then when you make more eggs, they'll extract those eggs. And after they extract the eggs, they'll take the sperm and they'll either place it in the egg or they'll place it close to the egg. The egg will fertilize and then becomes an embryo. And then from you have the embryo, then they place the embryo back into the uterus, and then hopefully everything works perfectly and you have a baby in 9 months. That's a simple way of putting it.
Right. It sounded so
A lot more
simple.
complicated, but it's a simple way of doing it.
But no, the explanation felt simple. It sounded simple. So thank you for that.
But I'll tell you that there's thousands of women that go through IVF every year, hundreds. I don't know the exact number, but there's a number of them.
Mm-hmm.
And I get to see the male end, but I also talk to to their partners, and it's very tolerable. Like it's so many women go through it, and it's not something to be afraid of if that's your only option.
Understood.
I mean, the goal is to be, if that's your goal, is to be a parent. And so, I think I would say that probably 99.9% of them will say that it was definitely worth it, unless they have a problem child and they say probably not. I don't think so. Let me take that IVF back.
Oh my goodness.
But in general, I would say that most of the people that go through IVF, they're very happy. And in severe cases, like I mentioned, there are some genetic abnormalities where if they're missing that chromosome, so if they're missing that gene on that chromosome, then there's nothing I can do, right? In those situations, then those couples, they'll use something called donor sperm, so they can find, a compatible person that kind of looks like them and, have a lot of different have the same characteristics, and they can find a donor sperm that they can use for IVF or something called IUI, or they can adopt. So, but that's in the, I would say that's not as common as us being able to help someone to either find sperm or increase their sperm counts.
Okay, so more extreme cases.
Yeah, I mean, it happens, but it's not as, it's more common that we're able to have a couple have a biological child.
Nice. Family, welcome if you're just tuning in. And for those of you that have been hanging out with us on our journey, thank you. You're listening to Love and Life. How about that? You're listening to Love and Life on WURD, Progressive Black Talk Media. That's 96.1 FM and 900 AM. We've been talking with Dr. Paul Gittens, and I don't know about you, those of you who've been with us for the ride, but I feel smarter. I feel like I know a little bit more now than I did, just a little bit more. But I still have a few more questions. We were talking about sperm count most recently. Can a male with low sperm count still impregnate a woman?
Yes.
That was a loaded.
Because it's nothing in men. There's not in my field. There's always we can always try to make things happen. And like I said, I'm an internal optimist. And so the answer is yes. It just depends on how low. So it always depends. It depends on how low. So, there are men that have a lower sperm count
Sure.
and they can have children, right? There are some men that have a lower sperm count that can't. So, it depends on how low. It depends on the fertility of their partner, right?
Okay. I was about
Um,
to say the determinant.
yeah, so there's a lot of things going on. So, but it also depends on how low. So, the lower your sperm count is, the more difficult of a problem you're going to have. So, if you
Mm,
have, so say the average sperm count is about 60 to 80 million, and if you but the lowest criteria is 15. So, if you're 15 million, then you should be able to have a child. But if you're 60, you probably accomplish that a lot faster than, not necessarily, but you're gonna have a better luck than if you're 5 million, right?
okay.
So it just depends on where you are. There are some critical numbers. If somebody has 1 million, it's gonna be very, very difficult for them to have, a natural conception without any help.
Uh-huh.
If they're getting closer to 15 or 20 million, then it's going to be a little bit easier. So it depends on what that number is. But the count isn't everything. Like I said, it's also like how the sperm are moving. It's also how they look. It's
Okay.
a number of things that can affect it. Um, and and just like with erections, and sexual function, fertility is also somewhat based on what we're doing to our bodies, right? So we do know that guys that smoke a lot of marijuana, per se, they have a lower, sperm count,
Okay.
than men that don't, right? So when I see a guy that comes in and he's smoking every single day, I tell him, listen, you got to cut down on smoking, and we recheck it in a couple months, and oftentimes it's a lot higher,
Oh,
right? So
wow.
we do know there's some drugs and toxins in the environment and what we put in our bodies that can affect our fertility. Um, so
Mm,
it's interesting, even smoking, and we're all going to say, everybody's going to say, listen, I know a guy that, he smokes marijuana like 3 times a day and he's got like 5 kids and all these other things. But it also depends on that. It depends on the person, right? Because you can think of, like, 10 people can smoke and 5 people can get cancer. The other 5 people,
mhm.
maybe not, but why,
Sure.
right? So
Sure.
it's that connection between, what you're doing to the body and how your body translates what it's doing. And that's what it comes down to, genes and all these other things.
So, talking about sperm, what color and texture is healthy sperm?
So, most sperm are like an opulent color. It's, kind of closer to clear to opaque.
Okay.
Um, if a person sees blood in their semen, then we should probably get a urinary. We'll check a urinalysis. We'll check their PSA to make sure there's no issues with prostate cancer. We'll make sure that they don't have an enlarged prostate, which is probably
Mm,
the more common reason why guys will have some blood in their semen.
okay.
But a good opaque color, clear, is a fairly good color. It depends on a number of things. It depends on how many times you're having intercourse as well, in terms of the volume and how it looks.
Oh,
If you
that
have
makes
sex
sense.
once and you have sex 2 or 3 times that night, then it may change a little bit in terms of how much is coming out, as well as the color and everything.
Hmm. Does alcohol affect a man's sperm count?
Too much alcohol can, yeah. So if somebody is chronic alcohol abuse, if they're drinking a lot, then it's going to affect their hormones, because it affects those brain hormones. And it
Okay.
also is, we call it in the medical term, we call it a gonatotoxin. That means that it's a toxin to the gonads.
Yes,
And back to those
gonatotoxin.
gonads again. I wanted to throw that in there because you had mentioned gonads before. So
Thank you. That was for
we
me.
call it a gonadotoxin, and so it can affect the testicles directly if it's chronic alcohol abuse. But 1 or 2 drinks is going to be fine.
Okay.
I'm not worried about 1 or 2 drinks. There's some studies where it shows that if you drink more than 6 to 9 drinks in a week, then you can have some lower sperm counts.
Oh,
So
wow.
if it's and you're doing that chronically, then that can affect it. But it depends on that. It depends on that individual. There's going to be some guys that are going to be able to drink as much as they want and have 20 children, and there's going to be a guy that drinks just a few or smokes just a little bit, and that's going to affect their sperm counts.
Sure, that makes sense to me. Family, thank you for joining us. We are delighted to have you with us. You're listening to Love and Life on WURD, Progressive Black Talk Media. I am Carol Riddick, and I am joined by Dr. Paul Gittens. And I've just been pressing Dr. Gittens with all of the hard questions that I know you all want the answers to. But he's been so accommodating, OMG, and we've already planned our first TikTok dance. So um, I'm excited. I don't know about you. Dr. Gittens, we have a question. Can diabetes interrupt your sexual performance? And if so, how?
So, as everybody knows, diabetes is it's it's prevalent in the Black community, right? And what happens is you get an excess of sugar in the body, and that sugar in the body can then affect a number of your systems. It can affect your eyes. It can affect your legs. I remember growing up, I had an aunt that had diabetes, and she had some amputations.
Mm.
Um, it can affect your nerves, and so you can get something called neuropathy, where you either have a lack of feeling or decreased feeling or tingles in your fingers and your feet. But it can also affect your sexual function. And so for men, it can affect their erections, their ability to get an erection. It's actually one of the more common reasons why guys have erectile dysfunction or difficulties is because of the diabetes affecting their vasculature and affecting their nerves. It can also affect a guy in terms of their ejaculation. So some guys with diabetes, instead of the ejaculation coming out forward and to the outside world, it can go backwards and into the bladder. It's not a health problem, but a guy can see that. Um,
Mm. Is that painful?
it's not painful at all. No,
Okay.
they just won't see the fluid come out. So I had a guy. It was kind of funny. He said, "Doc, it's great. It's sex without the mess." But but
You
for
are
most
going to get
guys,
up and I.
for most guys, for most guys, it's not pleasurable. You're probably gonna have to edit that for the radio. But listen, you asked, right?
I did.
So for most guys, it's distressful. They're used to things happening in a certain way. So yeah,
Okay.
definitely diabetes it's a big concern when it comes to sexual health and
Sure.
especially with erectile dysfunction.
I want to talk about your one of your other specialties, vasectomies and vasectomy reversals. Um, are there health reasons? And I imagine, so forgive me if this is just an ignorant question, but are there health reasons that would make a vasectomy necessary? And in my mind, vasectomies come about because a man says, "Okay, this is what I want." But is that always the case?
It's not always the case. I mean, in a number of situations, if their partner, you know, is unable to use birth control for some reason, sometimes some women that are using birth control, they can have some adverse effects.
Okay.
Right? Some women may have an increased rate of clotting in their legs, for one. They can
Okay.
have some other problems with their blood. They can have some women gain weight on birth control pills. They can have other emotional problems that they can have with birth control pills. Some women are allergic to latex. Some guys are allergic to latex, right? So
Mhm.
there's a host of reasons why guys would want a vasectomy. Those are just a few of them. But vasectomy it's one of the most effective ways to prevent a pregnancy. You know, and for guys that I've some guys that had a guy come in. What was it last week? He's like, "Doc, I don't want to get trapped. I don't want to get trapped. So
Oh.
I'm gonna vasectomy. So I'm going to put it in my own hands." And I tell and that's one reason why guys want it. The main reason is really just to kind of have control over your family planning, right? We know
Sure.
that kids are expensive. they are they are really expensive, and especially in these times, we have to, we want to be able to provide for our children in the best way we can, and one way of doing that is to kind of limit our families for certain I mean, there's religious things and all these other things, but
Mhm.
that's one of the main reasons is really family planning. Um,
So are there health reasons that a man would for which it would be necessary for a man to have a
No,
vasectomy?
there's not any health reasons
Mm.
why why a man would opt for a vasectomy. I mean, it wouldn't. It's not something that would enhance their health.
Okay. Okay.
Um, I guess, I guess maybe having less children would enhance their health,
You're
make them live a little longer, maybe. But in
you
terms
got
of
jokes.
like, helping with like, heart disease or anything like that, it's not going to help with that.
Okay, is
Um,
it painful?
it's not painful. The way I do it in the office is we do a no scalpel vasectomy. That means that we have a special instrument that makes a small window after we numb everything. We have a special instrument that makes a window into the skin, a
Mm-hmm.
small little window. We also use something called nitronox, which is it's kind of sort of like laughing gas, so guys can inhale it and they can drive home the same day, and they feel pretty good. We have them use ice afterwards, and the majority of guys, they're able to go back to work the next day, depending on what they do. If have some guys, when I was in Texas that were part of the rodeo, we would tell them not to get on that bull. But in general, most guys go back to work, especially so many people are working from home.
I'm sorry, I have to go back to this. You said you give them, what is it, nitric oxygen? Is it, was it
No, nitric
like,
oxide. So it's like laughing gas. We give them
right?
like laughing gas. Yeah. So laughing, it helps with the anxiety that they may feel, and it just kind of calms them down because everybody's a little nervous when they come in for the procedure.
I can only imagine. I can
Yeah.
only imagine. So, okay, once a man has a vasectomy, does it affect his sexual desire?
It does not. So that's also, it depends.
Oh, really?
Yeah, and the only reason why it depends because there are some men that have some sexual dysfunction
Okay.
afterwards, and I want everybody to listen to the whole conversation and say, instead of somebody saying that vasectomy is going to cause sexual dysfunction, the vasectomy, it does not cause sexual dysfunction, but there are some men that are forced into having a vasectomy by their partner, or they're not emotionally ready, and because of that, they then kind of have some emotional problems that can lead to sexual dysfunction. So it's not the vasectomy, it's the fact that they probably didn't really want to have the procedure done in the first place. And so they have kind of an emotional response to it. Actually, I was talking to somebody this today. My most interesting patient was, if we talk about vasectomy reversals, my most interesting patient that I did a vasectomy reversal on was a priest, actually. It was the most interesting. I mean, so
Do
it,
tell.
Oh, it was so fascinating to me. It was a priest who, before he went into the priesthood, I'm not. Excuse my ignorance. I'm not really sure of the whole term.
Mm-hmm.
He actually had a vasectomy,
Okay.
and this gentleman who came into the office, he was about 75 years old, and he had a vasectomy when he was 20. And so he told me all of his life, all through his, in the church and being a priest, he had told his I don't know what you call them, the people in the church, that they should not use birth control, and they should try to have his kind of, he was Catholic, and so
So his
um
parishioners. He told his
his
parishioners.
parishioners, exactly, his parishioners, and he felt this guilt from the time he started his being a priest until he's now 75 years old. And he said, Dr. Gittens, like, the one thing I need is a vasectomy reversal, because I feel like he just felt guilty, and he felt like his soul was he was gonna go to hell, essentially, And so we did the reversal, and he comes in for his follow-up visit, and he's just a different person. Let me tell you, like, he comes in, and he's happy, he's smiling, he's like, his life has changed. It was a interesting transformation to see. That was the most interesting vasectomy reversal I've ever done.
That okay, that story is going to stay with me. That's really interesting. And the fact that you said his life changed, I'm sure it did.
Yeah,
I'm sure it did. But the fact that it that's such a long amount of time. He lived with that guilt for a long time.
he lived with his guilt for a long time.
A very
But
long
for
time.
most men, for vasectomy reversals, it's usually the most common reason for a vasectomy reversal, if we're
Mm-hmm.
changing gears to a vasectomy reversal, is that they've found another partner,
Okay.
and now with their new partner, they want to start a family with them. That's the most common reason.
So what's the average age for a man to get a vasectomy? What would you say?
For vasectomy, the average age is, I would say, about 30s or so. Usually when they're
Oh,
yeah, usually when they've completed their family. Um, so I would say late 20s to 30s is when we see most of our men come in for vasectomies.
that's really young.
Yeah.
Is
Uh,
so are vasectomies now this how much does a vasectomy cost? Are they expensive? Are they how does
so
that
some vasectomies, depending on the physicians, it could be covered by insurance.
Mhm.
If the physician, some physicians don't take insurance, and so it wouldn't be covered. For vasectomy reversals, they're hardly ever covered by insurance, right? And the reason for that is because you've made the decision to have the vasectomy, and now you got to live with your decision,
Oh my
right? So nobody's paying for
mhm.
that, right? And so the vasectomy reversal is often not covered, only in very specific situations where it might be covered. Um, and that's a totally different procedure. For men that come in for vasectomy in my office, it's about 20 minutes.
Okay.
I take about 3.5 to 4 hours to reverse it. So it's a long procedure to reverse it,
Oh
and it
my
requires they go
goodness.
to the hospital, and they have to go under anesthesia for that.
So it's a much more intense procedure
It's
than
a much more technically
involved?
involved procedure. Yeah.
Okay. Okay. Oh my goodness. So well now, so there's never a health reason that a man has to have a reversal.
No, for, no. Um, it's usually because they've kind of either found another partner, or I have some couples where they changed their mind, where they thought they wanted two children, and then they're like, all right, let's have a third, right? And especially a couple of years ago, I had a few patients that came in and they lost a child, um, and so in those situations, that's another reason. That's another more common reason why guys or a couple would want to have a reversal. But by and far, it's usually a change in partner.
So is there ever a scenario where the reversal cannot be done or cannot take place?
In most situations, we're able to complete the reversal. I mean, when we look at success rates, it's a different story. So when we look at success rates, the longer you've had your vasectomy. So if you had your vasectomy 40 years ago compared to last year, you're going to have a better success rate than if you had it last year compared to 40 years ago.
Oh.
So the sooner you get it, the better. In
So the
terms
gentleman
of
oh, I'm
success.
sorry. I'm terribly sorry to have interjected. So the gentleman about which you spoke a moment ago, the priest, that was a very long time.
It was a very long time, and I never even knew if it worked. But for him, it wasn't. It
It
wasn't
wasn't a
to have. It wasn't to have a child. It was more of a physiological and philosophical and spiritual, and
yeah.
that was more for that gentleman, as
Okay.
opposed to being able to father a child, because obviously he wouldn't have tried. It was just more of kind of his spiritual health, I think.
That makes sense. OMG. Family, family, family. You are listening to Love and Life on WURD, Progressive Black Talk Media. That is 96.1 FM and 900 AM. We've been having, I'd say, an in depth conversation this evening with Dr. Paul Gittens, and he has shared, oh my goodness, a wealth of information with us about several topics. Again, I just want to say again that I thank you tremendously. OMG. The conversation isn't over yet, but I want to say thank you, and I want to continue to thank you for accommodating and obliging us, and just, for participating and being a willing participant, in this conversation. Because, like we were saying earlier, some of these, a lot of these things about which we're speaking today are not, they don't come up in everyday conversations. And a lot of us are afraid to talk about some of these topics. And family, that's what Love and Life is about. That's why we are here. We want to talk about the hard, the hard subjects. We want to be informed. We need to be informed. How about that, for all of us to live a better life. And tonight we're talking about living a better sexual life, a healthier sexual life. And I don't know about you, but I'm all for that. Um, as we age, Dr. Gittens, what suggestions do you have outside of exercising to help us manage and maintain a healthy sex life?
I think as we age, I think the better your communication should get with yourself, right?
Mm-hmm.
The understanding kind of changes. I think with your partner, whoever that partner is, and
Mm-hmm.
if things aren't exactly the way they were, maybe talking about that. If things are hurting, talking about that. If things aren't working the way they used to, talking about that. I as I mentioned, there's so many people that hide from these things, and it affects their self-esteem and all these other things that affects their relationships. I think so. Communication is really key in terms of keeping that sexual health. I know you said no exercising and diet, but that's so important. So important. They go hand in hand. And so doing that is also really, really important. Um, and in relationships and in terms of talking and just and living life and trying to reduce stress and all these things are also really, really important for your sexual health. So those are some key points I think that we can all think about and we can try to figure out and kind of look through our day and kind of figure out where we can kind of improve on um,
I
to
thank you for
help with
that. I'm sorry again. I keep interrupting you. I'm
that. No,
so
you're not.
excited about this conversation. But no, communication. You said that communication is always key. I say that with regard to everything. Communication is so key, and I think that's a great place to start. Um,
Yeah, and understanding that all the and most things can be helped, right?
mhm,
I mean, there's no reason you should suffer with these problems, right? You know, we have, in our practice, this is, it doesn't have to be my practice here in New
mhm,
York, but, finding someone that really specializes and cares about what's going on with you and your sexual health
mhm.
is important. And you got to find somebody they have to be, I always, you kind of mentioned before about kind of caring about, you have to find somebody that's not embarrassed to ask those questions. And
Yeah.
because if they're embarrassed at asking the questions, then they're probably not going to be comfortable in treating you. Right.
How
So you
about that?
gotta ask those questions. And I feel like the physician's got to be comfortable with all of these things if they're going to be a good physician in terms
How
of
about
treating you in particular, you
I'm
know?
going to call you, and I'm going to suggest that everyone that I know calls you family. That wraps up today's episode of Love and Life on WURD, Progressive Black Talk Media. Thank you so much for spending some time with us. Your company and your attention are always welcome. Thank you to the entire WURD family. Thank you so much to my co host who alternates with me, Donovan West, our gracious show producer, the phenomenal Tiffany Bacon, and to our phenomenal guest, Dr. Paul Gittens. Have a great night, great morning, and a great rest of your day. Remember, we're all in this together. So be good to you, but be good to those around you. Make sure you join us at midnight for another edition of Love and Life on WURD. I cannot tell you how much I enjoy you. Be well, everybody.